Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Wow. Years ago, I'm not sure very many people could have ever imagined that we would be going through what we're going through now on our planet with the pandemic of the coronavirus. Now, this has led to a lot of canceled elective surgeries, and as an orthopedic surgeon, I've found myself home with lots of spare time on my hands. This has allowed me to venture into the idea of telemedicine and telehealth to contact my patients and to see how they are doing. It has also given me the chance to look back at some of my educational ideas that I've had over the years. I've been in practice now for 15 years in Southern California, and I work with fellows. When I'm in the operating room, I try to do my best to not only teach them about the surgery, but to try to vocalize what I'm seeing and what I'm thinking so they understand my thought process. So a few years back, I tried to create an outline of all of the things that I think about when I take care of my patients. Up until now, I actually haven't had the time to sit down and do much with it. But with the free time on my hand, I've been able to sit down with the podcasting equipment that I bought and some programs and start this journey into creating a podcast in the hopes that you'll find this information useful as well as educational. What I'm going to try to do over the next series of podcasts is go through in quite vivid detail for you what I'm thinking about when I see patients and when I care for them. This starts not in the operating room, but in the office. I'm going to try to explain to you what I do and how I choose who to operate on and who not to operate on, and how those patients may be optimized for surgery. I also want to go through in detail how I talk to my patients about what a knee replacement is and what they're getting themselves into to make sure that they have the appropriate expectations of the surgery and the recovery that they are about to venture into. At that point, we're going to get into the nuts and bolts of what I believe most people are going to be interested in, is in the operating room. But I'm going to go into all of the details about how I set up the room, and the surgery will be broken down into parts as far as the approach and releases, how I prepare the bone, how we do the balancing, as well as the closure and dressings. Beyond that, I'm going to talk to you about different tips and pearls that I've come up with over the years. And we're going to talk about postoperative pain control, the rehabilitation, and expectations about what patients may go through following this operation. We all know that 20% of knee replacements in the world, those patients are unhappy. And we're not 100% sure as to why. These are otherwise well-aligned, well-balanced knees. And still to this day, we're having a difficult time determining why. We know now that some of those are the younger patients or patients whose arthritis on x-ray is not as severe. And I do believe that a knee replacement in a lot of ways is like flying an airplane. The pilot may have lots of hours, but even when he steps into the cockpit, he still goes through the same checklist every single time. And when you're in the operating room, I try to find that going through that checklist is the same way that a pilot would go through the checklist in his airplane. And if you go through the checklist in a very strategic way and know when you need to deviate to check something else or do another step, you're less likely to miss something, make a mistake, or make an error. The way that I do it is not the way that you have to do it. It's just a way that's worked well for me and a way that my team understands what the next steps are. This tends to make a more efficient operating room. And I believe at the end of the day, it makes for a better knee replacement and a happier patient. So thanks for finding me. In the meantime, as we deal with this pandemic, stay safe. And I'm going to try to do my best over the upcoming days to go through and record and upload this virtual knee fellowship for you so that I can share some of the things that I've learned over the years with you so that once you get back into the operating room doing elective knee replacement surgery, you may find that some of this information is helpful both for you and, more importantly, helpful for your patients. I'm Adam Rosen, and thanks for listening. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.